And welcome back to another Doc Talk. Today we are going to be talking about having pesky elbow pain for those that are throwing a lot. So we want to go through a couple of ideas on what to consider, treatment styles, and what are some common injuries that actually happen there. So lead us off.
Yeah, so some common elbow injuries in throwers, whether that's baseball, possibly football,
Track and field. There's
track and field.
tons of throwing.
Yeah, so we can have something called medial epicondylitis, pain right here on the inside of the elbow. You can also have a UCL sprain, so ulnar collateral ligament sprain is the term of that. Kind of similar location as well. And then you can always have nerve entrapments, which you might not be able to feel anything, specific, just like, holy cow, pain in my elbow, maybe some kind of like sharp and tingling stuff that we've kind of talked about in terms of nerves as well.
What is medial epicondylitis?
Yeah, so the muscles in your forearm, and then you have that muscle turns into a tendon where it attaches to that inside of the elbow. So what happens there is most common, it's an overuse injury, which again, very common that we see that in throwers, people who are doing throwing constantly, and you get some irritation, inflammation right where that tendon comes in and attaches to this inside bone of your elbow or your humerus.
Yeah, so those are things that we commonly see with all of our throwers. If they're in our offices, we're definitely looking for those three. Pretty high commonality. That's going to be one of the things that they're complaining about, and we have to diagnose it correctly. Most of the time, those things are treated. There can be a little bit of difference between those. So that's the causes of these things are, like Dr. Betcher was saying, overuse, increases in either a big velocity change and decreases in recovery times, and then also mechanical errors. So overuse. So all of a sudden, little Jimmy's been playing catch with his dad, and now he's going into season of baseball, and now he's throwing 6 days a week, and he only has 1 day off. That's going to be a ton of load onto his elbow, and his body can't adapt quick enough. So an overuse injury, that would probably be a little bit more common with a medial epicondylitis. All of a sudden we start having a big velocity increase. The coach is asking little Jimmy to start throwing from third to first and try to put it on a line, put it on a rope. That might increase the amount of stress at the elbow very, very quickly, and that ligament can have a little bit too much stress in it. If you maybe start to do a long toss program and you're not ready for it, you haven't conditioned the tissues well enough, and you're starting to really huck the ball a lot farther, that could be also a big UCL injury potentially. When we look at, again, kind of similar to the overuse, but decreasing our recovery time, if you have a practice, say Friday night and you have a game Saturday morning, and you are not letting your body fully recover, and you did some pitching the day before, that can be a very big issue and can make that tissue almost more sensitive. The muscles take time to recover. If the muscles are constantly trying to recover over and over again, the nerves that go through there can have a little bit of a hard time passing through and sliding and gliding very easily. That's our nerve entrapment. And then we look at mechanical errors. So if little Jimmy is only throwing with just his arm and he doesn't put his whole body into it, or he has a lack of movement somewhere, then we're looking at a mechanical error there. So that's all stuff that we can figure out as the cause of these injuries, and we try to, and then we move into, once we figure out a cause, then we just figure out a treatment for them. So there's all sorts of different treatments that we have. What kind of treatments are we typically doing in office here?
Yeah, so definitely a lot of soft tissue manipulation, a lot of soft tissue mobilizing. So with a lot of injuries, there's going to be irritation to those tissues. Your body naturally wants to also kind of protect an injury, so you might see some tightening surrounding the area or at the area, in addition to, kind of the mechanical errors. There might be some tissue dysfunction or tension, or basically causing some disruption in movement elsewhere that we need to really address that to make sure that we can also help take away the injury at the location. location as well. So a lot of soft tissue work, we will do some manipulations, we can adjust the joints as well. And then when it comes to a lot of those entrapments too, you just want to find better ways to kind of get that nerve gliding, take pressure off of it, and work the nervous system so that, again, we can kind of have everything moving without compression or irritation to it.
So we like to use taping as well, kinesiology taping. It usually just kind of unloads tissue and makes the body have a little bit better circulation in the area. If we're worried about a patient going into the weekend and they have a couple of games and they're a little bit sensitive on certain areas of their elbow, we typically like to see if tape can kind of take some of that sensitivity off, make sure that there's a ton of circulation that happens, especially when we're trying to get more recovery. Taping's a very good one. And then we move into rehab / kind of like your technique evaluation. As movement professionals, we typically like to see, hey, how are they actually throwing? We have an examination, and that really kind of drives home either our rehab or trying to figure out different strategies for their throwing patterns. So say Jimmy's shoulder or his upper back doesn't turn very well and he's just doing this. We need to figure out a rehab plan that actually allows his body to start turning in other areas, not just torquing through the elbow all the time. And then if we have maybe a couple of videos of the patient actually throwing and competing, then we can kind of dissect some of that stuff too. Maybe we can identify that they're not getting a lot of drive from their lower body, so we need to up that input from the body, because the throw comes from the foot driving into the ground, and then finally the whatever object is being thrown being released from the hand. It's a full kinetic chain when you go through throwing. So if we can identify something for a patient that is lacking there, it can be huge for long-term success for that athlete. We have the movement professionals in the medical office, or our movement professionals on the fitness and gym side of things. Both can be very valuable for that athlete. So if you guys have any questions, if you know someone is struggling with throwing and constantly having elbow issues, reach out to us and we'll try to get an evaluation to them as fast as we possibly can and get them back into throwing safely as quickly as we can. If you need us, give us a call at 702-558-2151 and we'll get you scheduled up. Thanks, guys.